we really need about 640 nurses. And this is a standard established by WHO and the International Council of Nursing. This is to allow us to do certain patient to nurse ratios, so that this will allow us to have one nurse, let me get it correct. Yeah, one nurse to every 2 patients for critical care, one nurse to 8 for medical patients, and one nurse to 1 for cardiac. So this 640 is an ideal set to provide the ideal and optimal level of care to patients. This is what globally the standard is. But we have here at the hospital, we have the number of posts we have available for nurses is 456. So 456 jobs of nurses. Of that, we actually have 426. So we have about 30 vacancies, and those vacancies will fluctuate because sometimes you'll have a nurse, one going and one coming, but roughly about 30 vacancies. What we've done, because these are appointed, established posts, we've earmarked those 30 vacancies for the current class of graduates from Barbados Community College. Okay, so Barbadian nurses have been earmarked for those permanent positions. So, but what is great is that you have a group of Barbadian nurses. Not all will come to the QEH. Some will, of that 39, some will go to psyche, some, based on their preferences. But certainly we have 30, and we've been getting applications, correct, Susan?
Yeah, that's correct.
And so we're looking to recruit those that apply. Seeing that the established posts that we have, plus the vacancy, still bring us to 456, which is below the 640 that we ideally want. What have we been doing to increase the number? We have about a 4-pronged strategy. The first thing is that we're going to try to get 62 nurses from Ghana. So we are, based on our budget and resources, we're trying to get in more registered nurses. So that is the thing. So Ghana offered us nurses. They have specialist registers, so we're able to get a pool of nurses readily available, trained and experienced, that can come with similar cultural, norms that can come and fit into our context.
They will be assigned to the critical care areas, critical care, operating theater, accident and emergency, pediatrics, and we do have a few that will go to the med-surgical units, and that will kind of comprise, we have maybe 2 or so also for the pediatric area, but mainly there for the med-surg and the critical care areas.
There's still some remaining gaps, even though we've been able to get, even from the Ghana program, they didn't have enough. There's a shortage in their country, so they didn't have enough of what we call, cardiac? The cardiac nurses. Cardiac nurses are highly specialized, and we weren't able to top up our numbers with those, but we've been able to get in the other areas identified by Mr. Pinder. So that is our first strategy. That's important because, as you could imagine, the disease profile of Barbados is a lot more heart disease. It's really a greater demand. So it is still an area, but that is where our contract positions. And this is important because sometimes there is a thinking that you're trying to recruit people from overseas as opposed to Barbadians, and now I'm giving you that clarification. So we're going to take all the Barbadians literally that we can get, and then what we're going to do, we're going to look outside of Barbados as part of that strategy to get nurses, and based on our budget, we're going to bring as many as we can. The Ghanaian nurses that are coming are also very, very close to us culturally. They're very proficient in English. From what we've seen, the standard of nursing in Ghana is very similar in some instances because they work in resource care settings. Some of the nurses actually are highly skilled, almost to the level of some of our junior doctors, meaning that they do things there that some of our junior doctors here. So we are bringing a complement of nurses that we think will be a credit to the nursing profession and really be a strong complement to the very good nurses that we already have here at the hospital.
And they will be paid according to their experience.
Yes, that is important. They're not going to be paid more than Barbadian nurses because that was a concern. They're going to be paid just according to their years' experience at the same levels and rates as Barbadian nurses. No more. I've been talking this entire time about registered nurses. You're top of the line in terms of nurses. Now there are other categories of nurses. There are nursing assistants, there are health aides. What we're trying to do, we keep our complement of the lower skilled nurse topped up or as full as we can so that the nurses can have support on the ward with non-specialized areas. So if I can give an example, nurses give medication. Only a nurse can give medication. Only a nurse can do a care plan, but you can use your nursing assistants to make up beds, to help feed patients, to bathe patients. You get me? So if we can keep our complement of that lower skilled nurse full, it provides the additional hands that are needed. So that's the second part of the strategy, and I think we're full. Those positions are full.
How many are there?
There are about 185 nursing assistants.
Okay. You call them
Nursing assistants.
Okay, no problem.
Right, and you have, so the third strategy is that we have to retain the nurses that we have. The salaries in Barbados will never be as attractive as they are in Canada and the US and the UK. So we have to do all that we can to make it attractive for nurses to stay here and remain in Barbados. So we've improved the amenities. That was when we opened up the nurses' lounge. So they have very nice nursing facility. We're providing as many training opportunities as we can for nurses to get exposed to areas. We're also doing a lot in terms of reward and recognition. At the award ceremony, you would have seen almost every year the majority of awards go to nursing staff on an annual basis because we recognize the important work that they're doing to carry. Nurses are with patients 24 hours a day. So that's critically important. So recognizing what they do, ensuring contribution. The HR department is going to be working on a month-to-month employee of the month and other recognition areas that make people feel that you really appreciate them. So that is, what we're trying to do to make them feel like they're valued. But we certainly can't compete in terms of salary at this particular juncture. However, we're hoping to be able to do so by the creation of specialist nurses. The government has committed itself in its manifesto to paying and remunerating nurses that are specialized so you can stay be a specialist ophthalmology nurse. You can improve. You don't have to go into administration like Mr. Pinder or become a sister, but based on your years and your practice, you can become a specialized nurse. And we are going to be working closely with the Nursing Council to have them, this is our advocacy and hopefully the public's advocacy and certainly the trade union advocacy. All three unions have been engaging with the Nursing Council to encourage them to open up specialist registers basically for nurses in Barbados, because once you have nurses registered and recognized for their specialist skills, what naturally happens next is their ability to advocate for increased pay. And the government has said that they're willing to pay for specialist nurses, and that's a commitment that's been given. So we're thinking the combination of these four things, but really in the more medium to long term, getting our specialist registers open, and then being in a position to remunerate nurses better for these specialist areas that they're working in will go a long way, we think, to alleviating some of the shortages. The nurses notice in the hospital, I so value what they do. I think it is something, when I go places and I meet countries, and Jamaica has specialist registers, Ghana has specialist registers, I'm always distressed because I think Barbadian nurses deserve it. Fifth part of our strategy that we would include is that we will continue our policy of ensuring that nurses are paid and paid on time. QEH is not one of the institutions that is impacted by nurses being paid late or being delayed. So very often when you hear this complaint and concern, people immediately think of Queen Elizabeth Hospital. And actually, it is one of the areas that we get absolutely right. And I think it is one of the things that other people are attracted from the other institutions to come here. But part of what we try to manage very carefully, we can't take all of the nurses because it would necessarily deplete those from the geriatric and the polyclinic system. But we actually get that very, very right. We do not have nurses at the hospital. And this has been the case, Susan, for years.
For years. From the time we actually became a board.
From the time we became a board. So this is not a recent situation. It is a standard that we set. We get it right. Thank you.